Thank you for joining Portrait Pharmaceuticals as we discuss the various aspects of method validation. Today, we will be focusing on accuracy. First, we will discuss why accuracy is important and when should it be performed. Then, we will go over how it is performed most commonly for a drug product assay method. Then we will briefly talk about some considerations regarding specific instruments and/or techniques. The definition of accuracy is the condition or quality of being true, correct, or exact. The ICH Q2 guidelines describes it essentially being able to provide that you got out what you put in. It also specifies that it should be proven under the nominal test method conditions. The table here provides a quick guide for when accuracy must be performed based on the phase of your product and the type of quantitation that is required. Accuracy is essentially required for most methods. There's one caveat for phase 1 purity methods that we'll discuss momentarily. Accuracy is performed at 3 levels, most commonly 80, 100, and 120% of the nominal concentration of the method. For phase 1 methods, this is reduced to only include the 100% level at n equals 3 replicates. For later phase programs, the 100% level is prepared 6 times. We will go into more detail about the preparation on the next slide, but for now, spiking studies are performed where the drug substance of a known purity is spiked into the sample matrix. The recovery is calculated against a reference standard of a known purity. In earlier phase programs, it is normal to not have a large quantity of reference standard or have one qualified yet. And in these cases, the drug substance is used as the standard and the spiking drug substance. It is important to note that the placebo or sample matrix that the drug is spiked into should be representative of the final drug product. The ratios of the excipients must be the same as the final product. The acceptance criteria that you place on the accuracy evaluation should be representative of the type of method and the product form. For API, the accuracy is largely dependent on weighing of the material and proper sample preparation technique. Therefore, the criteria is tighter. For drug product assay and CU methods, the criteria reflects that the specification for a drug product is wider than the API due to the variability of the dosage forms themselves. For methods like residual solvents, where the accuracy of the instrumentation detection is limited, the acceptance criteria is even wider regardless of the product being tested. Here is a simplified version of the way in which an accuracy experiment is set up and performed for an assay method for a solid oral dose product. The design for other products like transdermal patches, semisolids, and injectables would be slightly different, but the concept would be the same. The placebo blend is weighed and added to the appropriate flask. The amount weighed should be representative of the actual sample prep procedure in the method. For instance, if the method calls for 5 tablets to be placed in the flask, then the placebo amount should be equivalent to what's in 5 tablets. The appropriate amount of API is then weighed into the flask. Alternatively, a stock solution may be prepared and a volume may be pipetted into the flask. Finally, the sample prep in the method is then followed. The accuracy preparations go through the same agitation of shaking, sonication, or mixing that the method indicates. The final test solution comes after the preps are filtered or centrifuged as specified in the method. These sample solutions are then tested via HPLC or GC or whatever your detection method is, and recovery is then calculated. Here are a few things that you may need to consider when developing your accuracy evaluations. Ensure that your acceptance criteria takes into account the limitations or sensitivity of the instrumentation used. For example, coulometric Carl Fisher is more sensitive than volumetric, so the criteria set for accuracy may be different depending on the instrumentation that you're using. There are some exceptions to how an accuracy experiment is performed, and any variations from typical or established procedures should be justified. But in the case of dissolution, some guidance is offered. For instance, if you are performing dissolution on a poorly soluble compound and the specification is not within the typical release limits, the ICH allows you to dissolve the API in a solvent that it is soluble in and spike in that solution into the media. The caveat is that the amount of solvent added must not exceed 10% of the media volume. Another thing to consider is when accuracy must be repeated. If there are changes to the formulation and/or method, the accuracy must be repeated to ensure that the method is still providing accurate values even when changes have been applied. This wraps up our introduction of accuracy. Please reach out if you would like a presentation on a specific type of method accuracy, such as dissolution or residual solvents. Our contact information is shown below. We would love to hear from you. Thanks again for joining us.